Hello everyone, my name is Dr. John Richmond of Delphi Medical Consultants, and welcome to our series of podcasts on the treatments that we recommend and prescribe for our patients with substance misuse problems. Without further ado, methadone. Why do we prescribe methadone? There's really three main reasons, backed up by a great deal of research over 50, 60 years now, that shows that methadone has a significant effect to reduce the number of deaths that occur secondary to opiate misuse. It also reduces the amount of crime that is committed as a result of the need to get money to buy opiates. And finally, it also reduces the morbidity or the adverse health consequences of using opiates, such as abscesses and deep vein thromboses and those sorts of things. The evidence for it is compelling. It makes the decision to prescribe for a doctor who makes a diagnosis of dependence on opiates an easy one, such that when a patient comes in usually quite desperate circumstances, it feels like the right thing to do, and we have a large number of doctors that agree with that. And also, you see your patients improving in their outward aspect of health within 2 to 3 weeks. Really, if you review someone, you will see them visibly become more healthy looking. So that's compelling. It's hard to argue with as a doctor, but there are lots of arguments against it in terms of that you are just replacing one opiate for another. You are giving someone an addiction to potentially another drug as well as the one that they're already on. And people argue that it delays people's recovery from dependence. I say again that one of the big things about methadone treatment that makes it compelling is that it results in fewer deaths. So if there's one thing that you can't recover from, it's death secondary to opiate misuse, and keeping someone alive results in them at least having the chance of recovery. I don't think that it is the be-all and end-all. It's not 100%. The answer to substance misuse, the real answer to substance misuse is people stopping using substances. And we have to work hard to make that happen. And it's almost a separate story to the methadone one. Methadone provides a gateway for people to get from a point of being quite unwell and lost in a cycle of constantly using and buying drugs, and it creates a space for people to be able to potentially put some things in place that allow them to get better housing, get better jobs, or get a job. So I think it has its place. I think it's useful. These are the reasons that I've given you, those three reasons I've given as to why we prescribe it. They are compelling to us as doctors. As people who want to help people, they're compelling because we see people improve, so that their outward health is better after being on methadone for a couple of weeks. The dangers of methadone are the fact that once you're on it, all those risk factors around death, disease, crime are reduced, and the impetus for moving away from that is also reduced. So people come in saying, I want to get away from this lifestyle. And really, once you're on methadone, you're quite a long way away from that lifestyle, although you're not all the way to a drug-free life. So some of that drive is lost, and it's important that we understand that as doctors, but it's also important that you understand that as a patient, that getting stable on some sort of substitute medication such as methadone is the first step on a journey that requires a behavioural change on the part of the patient. So it's really becoming someone different, and methadone doesn't do that for you. That's something that has to be done internally, and is a psychological difference that has to occur that isn't provided by methadone, but methadone can provide the space for that change to occur.